Welcome to the Stratix Enterprise Mobility Insights podcast, where we talk about mobile technology in business, education, and healthcare. Whether it's new trends, new products, or better ways to do things, our goal is to give you useful information that'll make your organization better. Today, we're talking about how we can improve safety for home health workers. Here's your host, Stratix Vice President of Strategic Alliances and Partnerships, Gina Daniel Lee.
Hi, everyone. Today's topic is really a good one. Today, we're going to be talking about safety for home health workers. When we attended the annual Homecare 100 conference recently, we heard from over and over again from industry leaders that worker safety is their top concern. So think about this. Unlike traditional healthcare settings, home healthcare workers have little control over their environment. They're going into a person's home, and unfortunately, some hazards may occur like overexertion, or heaven forbid, weapons, illegal drugs, verbal abuse, or even physical violence. So what are we going to do about it? My guest today is a real expert in this area. Morgan Kircher is Chief Development Officer for Katana Safety, a company that specializes in protecting home health workers and social services out in the field. Hi, Morgan. Welcome. I'm really glad to have you here today and for us to be able to have the chance to have this conversation. But first, would you tell us just a little bit about yourself?
Absolutely. Hi, Gina. Thanks for having me. I'm excited to be on the podcast. My name's Morgan. Like you said, I've been in the home health and hospice industry for most of my career, for about 15 years. I worked at one of the leading home health and hospice EMR companies for a long time. That's where I grew up, I like to say, and learned about the industry. But I also have family that own home health and hospices, and I have a lot of family that are also clinicians in their own fields as well. So it's close to my heart, but I also love mission-driven organizations, and it's really important to me to be behind an organization that is really out supporting people and on a mission to help, right? That's the number one goal. And Katana Safety absolutely does that. So I'm very excited to be now part of their leadership team and continuing to promote safety in this very specific area of the healthcare industry.
Nice. What a wonderful job. And, thinking about home health, and let's start by talking about what are some of the most common dangers out there for health workers, Morgan. I mean, I've done a little bit of research around this, and I think that our listeners will find some of these answers really shocking.
Yeah, it's unfortunate, to get a nursing degree or any of those, to work so hard to do that. And the number one goal is to go in and they just want to care for people, and take care of them. And then they're continuing to walk into situations that are, unfortunately dangerous, for a lot of reasons. And we hear a lot about this in hospital settings, but we sometimes forget that there are a lot of providers that are actually just out in the community, going into neighborhoods they've never been in before, driving all day, and walking into homes, into very tense situations. As well. Those can happen from home health, hospices. You've got the patients themselves, but also family members that could be there, or other people that are coming in. So lots of things could happen. We were doing some research, obviously, and the U.S. Bureau of Labor states that workers in home care experience more than double the national amount of workplace injuries or violence as well. And 61%, if you went out and polled them, say that they've experienced some sort of specifically workplace violence against them. So 61% of people are reporting that, and that probably still yields to a lot of unreported incidents or even feelings of uncomfortability, we like to say. So some of the most common things we hear about are verbal abuse, sexual innuendos and aggression towards nurses, threats, sexual harassment in general. Those things, often you hear that they've learned how to de-escalate those situations or move past them, but it's still very uncomfortable to be in, and sometimes really discouraging when what you want to do is protect and help people to feel better and become healthy. So we're really seeing that there's a lot of measures that can be taken. Obviously, they can go into homes or they can come into their organization and be taught on orientation, lots of strategies to do things. They can also be given violence prevention training and things like that. But overall, it's still a really big issue that keeps happening.
Yeah, some of those statistics are staggering, Morgan. Overall, though, what does this mean for the industry?
The industry is growing really fast, and you're seeing the patient population is just exploding. Everyone's getting older and needing to be cared for, and we're not only seeing home care, home health, and hospice being a major player in continuing to take care of patients, but hospital at home is becoming a new area of focus as well, right? So we're just seeing less and less patients being seen in facilities and more in the home, and we really have to be proactive in how we are handling all the workers that are out there providing this care. You don't have, your nurse manager at the desk watching everyone go in and out and able to escalate a problem. You're out on your own in the field. So lots of things come up on how do we attract talent to come into a field that's potentially more dangerous? How do we retain them? And then it's an industry that it has a reputation for not being safe. So it's just going to continue to be a challenge that we have to have solutions for.
Yeah, that's unfortunate. And it seems to me that unfortunately we're talking about this topic more and more.
Yes,
and it kind of makes me wonder, is it a new concern? Or has there been just such a rapid growth in this particular industry that it's leading to more frequency of these types of events? Or, even more importantly, how do we help keep these workers safe?
Yeah. I think you're right. We are hearing about it more. I think it's always been happening. I think there's always been some instances, right, that have occurred in the past. And I've talked to a lot of clinicians who said, I've been doing this for 20 years, and this is things that have happened to me over the course of my career. But anecdotally speaking, I'm also hearing that you're right. It is happening a lot more often. Again, it's a theory, and again, it's anecdotal, but, it has increased since the pandemic. And we don't necessarily know why. It's a speculation at this point. But it could be a lot of the reason is just heightened social isolation of a lot of these people who just don't have the ability. They are truly homebound. They just don't get a lot of social experience. And I think they lose the ability to recognize socially appropriate behavior and interactions as well. So again, that's my own personal opinion of some of the reasons it may have escalated. But I do think you're right that we're hearing about it more often. Maybe these nurses are just feeling more confident to speak up and say that this is important and it's something that we all should be aware of. And unfortunately, some major incidents have occurred that have brought it to light, kind of to the public eye as well.
Yeah, I think that's really interesting perspective. So, let's turn to the how for a minute.
Yeah.
Like, how can we help home health workers stay safe? And more importantly, how does, Katana really play into this?
Yeah, absolutely. Well, there's things that agencies are doing today that are great. I think every nurse, every clinician, care worker out there should have their own personal agency to use their gut, right? I don't feel safe. I need to see that feeling. That's a proactive feeling, though. I listen to myself, have the agency to say, I can't go into this environment. Something's going on. I need to walk away. Potentially, hopefully not at the expense of the patient care, but you have to protect yourself so that they can get the right care. But a lot of nurses still decide, I can put up with it. I can handle it. That's what they believe. They want to give that care and continue in. So, agencies are coming up with strategies and protocols. If you don't feel safe, take someone with you to have a buddy or an escort in those situations, or, call and let your manager know before you're entering a building or a place that you think you might be unsafe, and then let us know when you leave. And those are protocols that you can follow, but those you have to know in advance that you're going to feel unsafe, which is a problem. Those unexpected moments still occur that you didn't necessarily have a plan for. So Katana can't, we have thought that through. We've thought what happens when the unexpected occurs. And that's really our mission, is to be there. We said, one of our slogans is never a lone worker. We don't want you to be alone, right? Even though you are singularly one person walking into a place, we want you to know that someone can and will always be just a phone call away or just a button push away. And so we thought that through pretty well, I think, and thought about how can we ensure that you have something in your hand or something available to you to connect in a lot of different use cases. And what we have found, and why we're having this call today, is generally speaking, a clinician is going to have some sort of phone or device in their hand. They're generally utilizing it for their clinical documentation, for outreach to their management team, et cetera. And they have that available to them either in their pocket or physically using it. And so it's very nearby. Whereas there are lots of other tools that are out in the market today, but maybe they're at the bottom of your bag. Maybe you didn't charge them. Maybe you forgot to bring it out of your car. And so we've tried to take all of that into account and come up with multiple different ways that they can get help. And so we have the ability to press a button on the back of our device for the most emergent situations where it makes a very loud noise, draws attention to yourself, draws attention to the issue, and alerts emergency services immediately. We have a 24/7 response center that is specifically built for responding to emergency calls, dispatching when appropriate, helping you through those situations. We have a silent alert for instances in which you want to be hidden or discreet, so that you want your phone to ring and maybe de-escalate a situation, et cetera. So lots of different ways that we have built the system to ensure no matter what situation you're in, you have a path for help or a path for someone to reach out to you and offer assistance. Those are some of the tools.
Yeah, I love that. And I love the thoughtful approach that Katana has taken here as well. Sometimes maybe nothing has actually happened, but
Absolutely.
a worker may feel uncomfortable, right? It's kind of that proactive thing that you were talking about.
100%.
And has a sense of danger. Maybe some things that come to my mind is maybe they're going to a new place or walking through a dark parking lot alone or on a deserted street or trying to get into an apartment complex. How does Katana help in those types of situations?
That's actually, we say we like to prevent issues versus solving them if at all possible, right? We want to be proactive for you. And our most used and common feature and functionality that is called Walk With Me. And it's really where they can utilize the system to proactively call emergency response and say, I just don't feel comfortable. I want someone to know where I am. It's your phone a friend, but you don't have to bother your friend. You can bother our services and say, hey, I don't feel safe. Can you just be on the line with me? And they're trained to listen in the background for danger, for any issue that might be going on. And you can say, I just need you to get me, I'm going through a neighborhood that I'm just unfamiliar with, or there's a lot of activity on the street and I'm carrying my, supply kit and things like that it's uncomfortable for me to walk alone. It's a hospice visit late at night, that I needed to park, under a lit spot, but it's much further away from the home. So now I need to walk. Lots of different use cases, that come into play. Can you be on the line with me until I feel safe again? And that's called Walk With Me. And that's our most used feature of our system, is that proactive, feeling of security to ensure someone is available. If something happens, they know where you are. They know everything that's going on, and they can, again, dispatch immediately to emergency services should the situation need that.
Such a great feature. It really is. In preparing for our conversation today, I looked a bit on your website, and there's a lot of discussion around this concept of circle of safety. Tell me a little bit about that.
Yeah, absolutely. I think this is a really cool feature, especially for the organization that's implementing this. You can, put out protocols for your team to say, the people in your circle of safety need to be, for instance, your manager or your director of nursing, or if a security person, if there is one of those on staff. But anytime there is an escalated alarm or interaction with the emergency response team that is cause for concern, or a dispatch of emergency services has occurred, this circle of safety, these key people will immediately be called into a conference call together to say, we know that Morgan was at this location and that some emergency services have been dispatched to her. We want you to be aware, and either hopefully everything is resolved in a positive note, but we want you to be aware of what's going on so you guys can work together to take any other action outside of the emergency response that needs to happen. Perhaps there's multiple patients on her patient load. Perhaps her family needs to be notified, et cetera. There's lots of different reasons for that, but that allows you to not, at the end of the day, as the nurse manager, to say, did you know Morgan had a dispatch this morning of police? She just hasn't had the capacity to reach out to you and give you all that information. You're going to know really upfront and be able to help.
I love that. Let's
Absolutely.
talk a little bit about benefits. How does the Katana solution benefit home health agencies?
Well, I think there's a lot of benefits. It's a long list. Obviously, those agencies are out there to care for people, right? But your biggest asset in doing that are all the people that work for you. And I think it's really important for any organization to put those people at the top of, we care about you, top of their list, right? We care about the caregivers and the clinicians. And so number one, it's going to keep them safe, or it's going to provide them with a mechanism to keep them safe should they encounter unexpected events. But it's also, we're hearing recruitment is so hard in the industry. The industry's growing. How do we recruit more and more people? Well, I see a lot of organizations just offering, more salary, more upfront dollars. And while that's great, and I know they'll take them, these personalities of these nurses often are, that's not what matters to me as much as doing good work and being in a place where I feel valued and I can feel safe in doing my job well. And so I do think that a big benefit is putting this as it's part of your benefits package to your team and saying, we have invested in ensuring that you feel comfortable and you have some sort of mechanism with you to provide safety as well. So that's one. We also see, a big benefit is you can also see where in your community are your consistent places where your staff are feeling uncomfortable or where they have issues. So a lot of the back end of our system is really that management piece and analytics to go. We tend to have areas of concern in our regions. And so from there we can say, well, we're uncomfortable often because of animals that aren't being put away or family members or just things that are out there that are happening. You're able to collect some of this data and information and then create new protocols or create, new actions where this home seems to be one particular home that's dangerous. We're going to always send 2 people to this home now that we have this information. It's just actionable and allows to take some of that liability off of those situations because you have this information now. So that's another one.
I don't think I would have ever thought about animals, actually.
I mean, it's not just people, right? I mean, it's situations. They're going to have this traveling. You're in an automobile accident. You are in a weather event. So we have some other features like mass broadcasting to say, everyone in the organization, we want you to be aware of, unfortunately, we have to say these things today, of an active shooter situation in this part of town. Can you tell me that you're safe and provide us your location because we want to be able to take care of you. And so you can send out some of these kinds of features as well and communications just to make sure that proactively, you know what's going on. Maybe there's a tornado or a hurricane, depending on where you live. Where is your team? Who's on the road? Has everyone found cover, and is safe? So lots of ways we can interact for safety, not just a one-on-one, violence event.
That's great. As you know, Stratix whole business is focused on mobility, right?
Absolutely.
Let's pivot just a little bit and talk about the mobile device, a solution like Katana runs on. I mean, the first step is educating folks about, on the powerful features that Katana offers. but how do you actually make sure that they're taking advantage of them?
Yeah, absolutely. Well, our app that is, we're a three-pronged approach. There's nothing that we can't do without without the app, the device, and the people on the other end of the line. So that you're going to get that are live. But as far as the app goes itself, that's going to be on any device that they utilize. So any mobile device that they're using, the application can be on there. It has a lot of the features and functionalities, and we can push messaging, we can push user training, videos. We want them to use it fully, we want them to practice. You never want to have to think about, how do I call for help if you haven't used it in 6 months in this one event. And so we definitely encourage them to utilize the system often, to call and say, I'm just testing, I'm doing fine when they answer. And it's really easy. We try to provide videos of those use cases from day one through the device so that they can get used to it, and run through a lot of those scenarios and be comfortable with it.
No, that's great. And, and I think together, Stratix and Katana really are a powerful combination. I mean, with the really impactful solution that we've been talking about today from Katana, coupled with our managed services, I think is just a really, winning combination, and something that is a huge differentiator in the market and in this space in particular. Morgan, thank you so much for your time today and for sharing your insights. I mean, I think this has been a really important conversation, and I'm so glad that we had a chance to have it today.
Well, Gina, thank you for having me. It's an honor and pleasure, and I look forward to the next time.
I do as well. Listeners, thanks for tuning in. I look forward to next time. Goodbye.
Thanks for listening to the Stratix Enterprise Mobility Insights podcast. If you like what you heard today, please share it and visit stratixcorp.com/podcast to subscribe. That way you'll never miss an episode.